Just come on this way. Okay, I need you to raise your right hand. You solemnly swear that you will tell the truth, the whole truth, and nothing but the truth, so help you God. Okay, go ahead and make yourself comfortable there. You've got an aerial mic there in front of you. I need you to state your name for the record and spell it for me so that my court reporter can get used to your voice.
Yusuf Ibro, Y-U-S-S-U-F, I-B-R-O-W.
Y'all hear him okay? Okay.
Thank you, Your Honor. Good morning, Yusuf.
Good morning.
Thanks for joining us here today. Could you tell the ladies and gentlemen of the jury a little bit of your educational background?
Yes, I graduated from Mount Carmel College of Nursing with my bachelor's in nursing in 2018. I've been working at Mount Carmel since 2015 prior to graduating from school.
Okay.
Yeah.
You got a great voice. Just belt it out for
Okay,
us.
sorry.
Okay, because everybody's got to hear you, and
Okay.
I know you might be nervous or whatever. Just take a deep breath
Okay.
and let us have it.
Can you guys hear me now?
I think they need a little more.
Okay. Can you hear me now? Okay. Like I said, my name is Yusuf. I graduated from Mount Carmel College of Nursing in 2018. I was working at Mount Carmel prior to that, started in 2015 while I was in school. And then I started in the ICU when I graduated with my bachelor's in nursing in 2018.
Okay, thank you. Were you licensed in 2018?
Yes, I was.
Are you still employed in the healthcare industry?
Yes, I am.
Okay. I want to take you back to an ICU patient that you encountered in September of 2018. Do you remember a patient by the name of Bonnie Austin?
Yes, I do.
Okay. And is there any particular reason why you remember Mrs. Austin?
I was fresh out of orientation. I was a new grad. She was my first patient that I had on my own that passed away.
Okay.
So that's why I remember her.
Okay, thank you. And Yusuf, were you scheduled to even come into work that night?
I was scheduled, but I was on call, so I was not there from the beginning of the shift.
Okay, can you explain what on-call means in this context?
So essentially, depending on how many patients are in a unit in our ICU, it calls for a certain amount of nurses. So if there's less patients than amount of nurses that's scheduled for the night, then they'll put certain nurses on call until other patients come to the unit, and then they'll call you in. There's a possibility you may never be called in, and you just kind of stay on call all night.
Okay, and this on-call status, was this a rotating status, or was this because you were a newer nurse? Please explain.
So with the on-call policy, everybody gets rotated through. But since I was a new grad, I've never been on call, so I'm first on the list. At that point, I was first on the list that night to be on call. So I was called in probably a couple hours before my shift to let me know that I would be on call for the night, and they would give me a call whenever they needed me.
Okay, thank you. And on that evening of September 30th, you did receive a call, is that true?
Yes, that's correct.
Okay. And what did you do when you got the call?
So I got the call around, it was 9 something, I don't remember the exact time. So you have about an hour to get to the hospital. I lived close enough, so I just got ready. After I received the call, I was told that there was a patient coming from the ER that was going to be my patient. So then I got ready and headed to work.
Do you know what time you arrived?
I believe I clocked in at 10 p.m.
Okay. And did you go directly to the ICU?
Yes.
What did you find when you got there?
So when I arrived, usually there's like, you find the charge nurse to see where your assignment is, but there was nobody around. Everybody was checking the patient in. So I think I found a nurse, and then she told me where everybody was, what room everybody was in. So then I went over to the room.
And whose room was that?
Miss Bonnie Austin.
Okay.
Yeah, you're starting to get
sorry.
your voice down a little bit.
Did anyone brief you as far as her issues?
Yes, so the charge nurse was in the room alongside with a lot of other nurses, and then she gave me a quick report about what was going on, so I could take over.
Okay. Do you remember what her chief problems were?
So she came in as a cardiac arrest. From what I remember, I was told that she arrested prior to coming to the ER and was intubated in the field. And then when she came to the ER, she arrested multiple times. She was down in our ER for over an hour, just arresting in and out.
Okay. Had a physician already talked with the doctor, had a physician already talked to the family about her code status when you got there?
Yes, so in report, I was told that that family was deciding on withdrawing on the patient, so it was just a matter of time. There were some things that they needed to talk over, because there's a lot of other things going on. So as I was taking a report, I was kind of already let known that this patient was going to be possibly terminally extubated.
Okay. And you indicated there were some family issues going on. Do you remember what those were?
From what I was told, I guess the husband was very upset of the condition. I was told that as soon as the patient got to the ICU, the family was brought back in so they could see the patient. And then I guess husband made some remark about killing himself. So they sent the nephew, I believe, home so he could collect the husband's guns and things of that sort. So that was being sorted out.
Did this create any sort of delay?
Yes.
Okay. I'm going to turn now to some medical records. And it should be noted that I did share these with Mr. Baez before we got started. So he knows that we're going to be putting those up. I'm going to refer to State's Exhibit 10C, which has previously been published in this proceeding. Okay, Mr. Ebrow, what does this appear to be?
This is a discharge summary by the admission doctor.
Okay. And could you please review that paragraph and let us know if you believe that correctly details this lady's condition upon admission and the course in the hospital?
Yes, everything's correct on there.
Is that better for everybody? Okay. So this details some presenting issues, correct?
Yes, correct.
Okay. You've already testified that she arrested, correct?
Yes.
And then there was also a discussion about halfway down about, in quotes, a large tension pneumothorax.
Yes.
Okay. Can you tell us what that is?
So it's essentially, like one side of her lung has collapsed, so they needed to put a chest tube in so they could reinflate the lung, and that's what it was.
Okay, thank you. And when you first met her or came upon her, what did you find relative to that problem, if anything?
So she had a couple things. She had the chest tube in still, and then she also had a pacemaker, temporary pacemaker on. She was intubated, and then she was on Levofed, which is a medication to bring the blood pressure up.
Okay. Talk to us a little bit about the chest tube. What did that look like?
There was some blood in the chest tube.
Where on her body was that?
I do not recall what side of the chest it was on.
Okay. Have you, in your practice or on this lady, seen what that chest tube for pneumothorax looks like on a person?
Yes, I've been part of, assisting with insertion of chest tube. Usually you give, as a nurse, you're given the pain medication as the doctor makes the incision so they can put the chest tube in.
Where does that go on the person?
Usually into the lungs.
Okay, and so,
She wants to know, how does it get there? They
Basically,
put it through
okay.
the side of the body, they throw it down?
Yeah,
the
so
throat?
basically they make an incision on the side of the chest, and then they go in there and it's a sterile procedure, and then they basically insert this tube in there, and then they sew it up and then put a dressing on there.
Sorry to interrupt you there, but
always appreciate the help, Your Honor. So that required breaking the skin and
Yes,
going inside?
yes.
Okay. And you also referred to the external pacer. Can you talk to us about that?
Yes, so she had on an external pacemaker, basically which is like a pad that you have one in the front and one in the back. That's the same pad we use for CPR. So you connect it to the CPR machine. It lets you know what's going on, like the rhythms. And in that machine, you could also turn it to a pacer mode, so we could capture, basically, her heart wasn't beating correctly. So then they had to put the pacemaker on, and then then the pacemaker was set to a certain rate. I believe it was 70. So that means she's getting 70 beats a minute, like throughout the whole process. And then there's a milliamp on there that you kind of mess around until you get like a capture. So basically you get a spike before what we call before every QRS, and that's how you know that's working.
Okay. Was she showing any reaction to having that equipment on her body?
Yes. Usually, I mean, it's like a small electric shock through the skin, so she's doing the load jerking of having a pacemaker on.
Okay, all right. Have you reviewed her medical record?
Yes, I have.
Did you contribute to her chart?
Yes, I did.
Okay. Did you chart her reactions to testing by you for her overall condition?
I'm sorry, I didn't understand the question.
Did you chart her reactions to overall condition, such as consciousness, pain awareness, whether or not she was alert?
Yes, I did a full assessment. I believe it was 2118 is when I put in a full assessment.
Okay. I'm going to place on the screen portions of State's Exhibit 10E, which is the direct charting flow sheet. I'm going to present that to the witness at this time. And I offer it to Mr. Bias. Let's go ahead and flip through the pages, see if they represent your charting.
Yes, this is my charting.
Okay, this is the second page from the document. And I see that there's a pain intensity scale and then a note, see below. The note does not seem to be too descriptive. Do you see that?
Yes.
TC. However, below that, there's discussion of the Glasgow Coma score. Can you tell us what the Glasgow Coma score is?
Essentially, it looks for how responsive the patient is. Are they moving their eyes on their own, or do you got to stimulate them, or are they doing anything? Same with verbal. Are they talking? Are they not talking? Are they grimacing, groaning? So it gives you a score, and we use the Glasgow scale for different reasons.
Okay. And you've scored her as a 3, which appears to be no response. Is that correct?
Yes, that's correct.
At the top of this next page, it indicates Pacemaker insertion location. And what have you charted there?
The external pacemaker, and the rate is at 70 beats per minute.
Okay.
You guys still hearing them okay? Okay. They're kind of shaking, give it a little volume there.
And then at top, at the next page, chest tube connectivity. And just for context, all these categories are in alphabetical order, correct?
I'm not sure how it
Okay.
is on there, sorry.
We can talk about that later. But what does this chest tube connectivity classification tell us?
Essentially, it's an assessment of the chest tube. It's set at 20 centimeter suction on the wall. It's clamped, meaning there's nothing going through it at that moment. And I noted that there was no bubbling that was noted. So just kind of assessing what the chest tube's doing.
Okay. Next sheet, level of consciousness, CAM. What does CAM mean? Is
I'm
that a scoring range or a tool?
It's a tool to see how alert a patient is, or if they're not alert. Usually there's like 4 or 5 options that you click through.
Okay. And then what does it say as far as your note, her condition?
As far as level of consciousness, she was obtundant. In orientation, I wasn't able to orientate because she wasn't talking. Most of our patients that are tube can't really tell you. You can't ask orientation questions for.
Okay. So for purposes of the jury, when you say orientation, what do you mean?
So you ask them, where are you? Why are you here? What's the date? Just kind of go through, see what their mental status is at that point. Are they confused? What's going on? But if they have if they're intubated, usually they're not able to speak to you to tell you that.
Okay, all right. And then pupil reaction, what does that tell us?
Essentially, you put a light through their pupil to see if they're reacting, if they're, does the pupil size change, and that's what you're looking for, and are they equal, but they were not reactive.
Okay. Next page. Category of response to stimulus. What does the note tell us there?
Patient is not responding to any stimuli.
Okay. And what kind of stimuli would you have been using?
So usually you go either on the nail bed, you kind of put like pressure, you can do it kind of through the shoulder to see if they have any response, do they move? That's what you're kind of looking for.
Okay. And then this lady had no response.
No.
Okay. We already know unable to speak. We established that previous. What about gag reflex?
So in the tube, in the breathing tube, there's usually a suction tube kind of connected to it. You kind of suction patients. A lot of times they have like a gag reflex when there's something down your throat, and she didn't have a gag reflex when I checked for her.
Okay. As to level of consciousness, what did you note?
Obtundant.
Okay. And the Richmond agitation scale, what is that for purposes of the jury?
I believe it's to note how agitated a patient is. Are they calm? Are they, are they, like you're kind of, it's a tool to give you a number as far as where their agitation scale is.
Okay, and what did you note?
It says see below, so I think there's another page for that.
Sorry. There you go.
I gave her -5 unarousable, no response to voice or physical stimuli.
Okay, thank you. Yusuf, do you recall what medications had been given to this lady at the point you met her?
Looking at the chart, she has not been given any medication. The only thing she was on Leofed that I mentioned, which was the blood pressure medication. But I did not see any other medication that she was given.
Okay. What is the medication administration record?
That is where all your orders for all your medications goes through.
I'm going to present State's Exhibit 10G to Mr. Brown. Sir, have you seen this before?
Yes, I have.
Okay. It appears to be one page. And let's review the medications. What's the first medication?
Fentanyl,
And the second?
midazolam.
And then there's a third notation at the bottom, and it is also for fentanyl. Can you explain what that third notation is?
So the third notation is after you give any pain medication, there's always a pain reassessment, and that's what that is just a reassessment on that.
Okay. And then at the bottom is the Levofed, correct?
Correct.
Okay. To your knowledge, is this the sum total of medications administered to Mrs. Bonnie Austin on September 30th, 2018?
Correct.
Okay. Did she have any fentanyl on board when the chest tube was placed in her body?
Not according to the MAR. But no, she was being intubated and she had a chest tube and placed down in the ER. They were using paper charting, so when somebody's coding, they use paper charting to where it shows what medication they're giving, like epinephrine and any other medications they use for coding, but that doesn't cross over to the MAR. And I did not see that until way afterwards.
Okay. But to your knowledge, as far as pain medication, this is it?
Yes, in the MAR,
fentanyl.
yes.
Okay. So let's turn back to the scene in the room for Mrs. Austin. When you entered the room, who was there?
The charge nurse and probably 3 or 4 other nurses, I believe.
Okay. And what did you first do?
I went over to the charge and got a report.
And then what?
And then I started doing my assessment on the patient.
And is this the assessment that appears in the medical record?
Yes.
Okay. And when you were done with that, what happened next?
At that point, like I said, we were waiting for family they decided they were going to terminally expect the patient, but they just needed to take care of some things. So we're just waiting for family to decide when they were ready.
Okay. And did a physician appear to manage this situation?
Yes.
Okay. Who was the physician that appeared?
Dr. Husel.
Okay. And what did Dr. Husel do when he got there?
So he came in to the room after family was ready, and then that's when I got the order for the fentanyl and the Versed.
Okay. And what was that order?
600 micrograms of fentanyl and 6 milligrams of Versed.
Was that order given verbally?
Yes,
Do you know who placed the order?
I did. I was on the computer at that point, and I entered it as a verbal order at that point.
Okay. As a verbal order, did you repeat it back and forth with the doctor?
Yes,
Okay. And were you satisfied that you were ordering what he wanted?
yes.
Okay. Did you pull the medication from the Pyxis machine?
No, I did not.
Who did?
Another nurse, Jason Sims.
Okay. What did you see Mr. Sims do?
As far as, I'm sorry, I don't understand the question.
As far as obtaining the medication, drawing the medication up, what were his activities with regard to the medication?
He went to the Pyxis and then brought back the medication into the room.
And did you see the original containers that the medication was in?
Yes, they were unopened.
Okay. Did you see him draw up the syringe?
Yes.
Okay. And then, once he had drawn up the syringe, what did he do?
He gave me the medication to scan in
Okay.
and to give.
Okay. So, when you scanned in the medication, do you have to place some things on the record as far as the status of the patient?
Yes.
And what are those things?
Usually it asks you for a pain score and like a sedation level also.
Okay, so we can see the medication administration record here, and there are some details down at the bottom. Can you read for us what those say?
Sedation level 4, somnolent, minimal no response, and that pain score is 6 on that
Okay.
one. And then the midazolam.
Okay. So why did you enter a 6 in pain for somebody that wasn't showing any reaction to any stimuli?
Rejection, eating.
That's I'll permit it.
So essentially my understanding was Ms. Bonnie Allison, looking at her records, she was on pain medication. She was on Norco 7.5. She takes that at home, so she's on pain medication. My
How did
understanding,
you know that?
it was part of her record. Like usually you're able to see in the initial, when she first got there, you're able to see every medication that she's on. And then you review the allergy, you review what medication she's at home. So my understanding was, she's been receiving CPR for over an hour. Somebody's, thumping on your chest for over an hour. She got a chest tube placed. She has a pacemaker that's externally being paced at that moment. She had a tube in her throat. So all of those are things that causes pain.
Okay. But you remember that you charted no response to anything,
Yes,
and that she had a chest tube placed with no medication?
yes.
Okay. what were you taught on the unit as far as anticipatory pain?
Sorry, I'm not understanding the question.
Do you know what the term anticipatory pain is?
Just anticipating pain. So you're giving pain medication in anticipation that the patient is going to be in pain due to something that you're about to do.
Okay, does this describe what you did here?
Yes.
Okay. Do you know what time you applied the medication? Or administered the medication, rather?
23:22.
Okay. And that's the fentanyl and midazolam?
Correct.
What happened then?
So prior to that, before I even gave the medication, I was waiting for, so the medication was verified, and then family was ready at that point. So then I was told by Dr. Husel to give the medication, pull the tube, and then let family in prior, like in that order at that point. So after I gave the medication, obviously the patient was not presentable at that point, so I was cleaning up the patient. And then after I cleaned the patient up, I took the tube out, and family was waiting outside, and then I let family in.
Did you have any discussion with Dr. Husel about the dosage?
No, I did not.
Had you been experienced during any time in training a previous palliative extubation on the ward?
No, I'm not.
This was your first one?
Yes.
Were you aware of any other palliative extubations that took place on the ward?
Yes.
Okay. And were those done by Dr. Husel, or was that done by Dr. Husel?
They're done, I think all the doctors do it. It mainly is done during the day, but it does happen at night.
Okay. And do you remember discussing with any other nurses or preceptors Dr. Husel's practice for palliative extubations?
From what I recall, I was told every doctor orders different medication for palliative extubation. There wasn't like a set medication or doses that everybody orders, so that was what I recall.
Do you remember testifying in a previous position, proceeding that Dr. Husel had a usual dose?
I've heard just
Objection.
Sustain. Let's rephrase.
I'll move on.
Move to strike, Judge.
Okay. Disregard the answer.
After the extubation, how much longer was Mrs. Austin alive?
I believe it's like 23 minutes, like from the, I believe, gave the medication at 23:22, I extubated at 23:30, and she passed away at 23:53.
Okay. And then States Exhibit 10H, is your final pain assessment?
Yes.
Okay. And it says what?
Pain relieved with medication, and then the sedation level.
Okay. Did this lady ever react to any stimuli while you were with her?
No.
Were you with her until she passed?
Yes, I wasn't initially. So after I extubated, I let family and I believe there's a daughter and somebody else, I don't recall who else was in the room. I let them know that I was right outside the room to let me know if they needed anything. At that point, I was anticipating the rest of the family was in the waiting room, and they were taking turns to come back and forth. So I went to my desk across the room to start charting. Probably like 2-3 minutes in, family came out, and they said they were leaving. So I asked them, is the husband coming back? And they were like, no, we're just leaving, we're going home. So I was surprised because I thought they were going to stay the whole time. So then after they left, I went back in the room to stay with Spotty Austin.
Okay, thank you. Thank you, Yusuf. No further questions on direct.
Cross?
Please score. Good morning, ladies and gentlemen. Good morning, Mr. Eva.
Good morning.
This is our first time talking, right?
Yes, correct.
So I just want to ask you, I think what we should start is chronologically a little bit. Miss Austin was in cardiac arrest before she ever came to the hospital, right?
Correct.
And then the squad intubated her, correct?
Correct.
And so basically, her heart had stopped. The ER realizes she can't breathe. The squad arrives. They realize she can't breathe. They intubate her, and she's rushed to the hospital. Correct.
Correct.
And once they get there, she's coding multiple times,
Correct.
which means basically her heart had stopped multiple times.
Correct.
And that's when they put a external pacemaker on her.
Correct.
I guess the purpose of the external pacemaker is because someone can't keep pumping her chest continuously as her heart keeps stopping, right?
Yes.
And that helps so someone doesn't have to keep doing that, right?
Yes.
That is also a painful process, correct?
Correct.
And as a result of all of this pumping on her chest, her ribs cracked, correct?
She had a,
Objection, that's not the medical records.
Okay,
It is.
stop you two. Objections on the floor. Let's rephrase the question.
You ultimately discovered that she had a punctured lung, correct?
yes, from the x-ray that they've done, they found that she had a tension pneumo.
And that routinely happens when multiple times you're pumping on the chest, correct?
Yes, it can happen during CPR.
So, in the efforts of saving her life, ribs cracked, lung gets punctured.
Your Honor, may we approach?
You may.
I can move on, Judge. I don't think if Ms. Gross.
Do you want to strike the
okay with that.
question?
I'd appreciate that.
Okay, new question.
So, in essence, she's down at the ER with her heart stopping and starting for over an hour, correct?
Correct.
And then when you arrive, there are multiple nurses already attending to her care, correct?
Yes, correct.
And the extubation wasn't rushed, right?
No.
In fact, there were numerous things that had to be done because her husband was attempting to kill himself.
Yes, correct.
And the family had to make sure and go home and get rid of the guns that they had at home.
Yes.
And there was all that going on. A lot of, I guess, let me rephrase this a little better. There's a lot of things going on at this time, correct?
Yes.
And at this time, the extubation is delayed, so things can kind of calm down a bit.
Yes.
And the order was given when Dr. Husel came in and he gave the order. It was given in front of multiple nurses, correct?
Yes.
Including your charge nurse, correct?
I do not recall who was exactly in the room at that point.
But you know it was multiple nurses.
Yes.
And nurses, of course, who had far more experience than you.
At that point, yes, I was a new grad, yes.
Okay. And not a single one of these multiple nurses that were in the room spoke up or voiced any concerns over the dose amount, correct?
Correct.
And in fact, you thought it was an appropriate dose, correct?
Object.
Sustained.
Based on your training and experience and what you had seen in nursing school and your experience with a preceptor and all of that, you found it to be an appropriate dose.
Object, Your Honor.
Sustained.
Did you have any issues with the dose when you heard the order?
So with the dosage, from my understanding, just from the brief, we don't go too in detail about palliative in nurse school and training, but we're told, because like for palliative extubation, you give medication, you give pain medications. A lot of times it's more than what you would normally give. And then from at that point, because of everything that has happened prior to that, I did not question the dosage because of, everything that's happened prior to her coming to the ICU.
So you took into consideration all the pumping up of the chest, the broken ribs and the lungs.
Object, Your Honor.
Sustained.
You took into consideration that she had a punctured lung, right?
Object, Your Honor.
It's in.
Okay. It's apples and oranges. Sustained.
Okay. Sir, you testified under duress, with this prosecutor asking you about that her lung had to be filled up with the tube, correct?
Yes.
So it wasn't a healthy lung, right?
The lung has collapsed, and that's why they had to put the chest tube in.
Okay. So, given all of that and the multiple arrests at the ER that you testified under direct examination, you took all of that into consideration when analyzing the dose. Is that basically what you said?
Yes.
And in fact, you placed the order. I'm showing you Joint Exhibit 10, page 48 to 49.
I'm sorry. Two people. This is med order.
Here is the order time, correct? 23:10?
Yes, that's correct.
And then the order was reviewed by pharmacy, correct?
Yes.
At 23:15, 5 minutes later.
Yes.
And the pharmacist was Talon Schroyer, correct?
Yes.
And he approved it, right?
Yes.
And then you didn't administer it until later, correct? I'm trying to find the exact time here.
23:23.
23:23. So that was after the pharmacy had approved it, right?
Yes.
So you relied on the verification that a licensed doctor of pharmacy reviewed this order and approved it, correct?
Object.
Sustained.
Did you rely on the pharmacy approval before you administered this dose?
So most of our medication we give gets approved by pharmacy, and I saw that the medication was approved by pharmacy.
And that, of course, gave you more confidence in the order, correct?
Yes.
Now, Dr. Brady was also at bedside, correct?
Yes, that's correct.
And Dr. Brady came in and took a look at the patient, correct?
Yes,
In fact, Dr. Brady also checked and noticed that she had agonal breathing.
yes. I think at that point she was starting to, because after family left, I was in there for a little while, and then Dr. Brady came in, and then that's when she started doing the agonal breathing.
And it wasn't because he got there. She was.
No, she was, yeah, it wasn't because she got there, but she was just starting the agonal breathing process at that point.
Okay. And she was on 100% oxygen, was she not?
Yes, she was on a ventilator at 100%.
So that would be a significant drop off from 100 to 21% oxygen in the room air, correct?
Yes,
And when Dr. Brady arrived and he saw her agonal breathing, he couldn't find a heartbeat, correct?
I don't remember what he did.
Okay, let me see if I can find that note. Can you find that for me? He's printing it now. It's the same note we went over. Reference. Okay. Now, after she was extubated, you said after like 2 or 3 minutes, the family left,
Yes, that's correct.
and Miss Austin was free of pain at that time, from what you can see.
Yes, she wasn't agonally breathing. She was resting comfortably.
Okay. And once they left, you stayed with her so that she wasn't alone when she passed away, correct?
Yes, that's correct.
Because you felt that was the right thing to do.
Yes.
Sir, you weren't part of any romance at the ICU unit, were you?
Sorry?
Sorry for the question, but I have to ask.
Objection, Your Honor.
Sustained.
You weren't,
Strike.
Strike the question.
you weren't part of a bromance at the ICU.
Again, object.
Sustained.
I thought the sustain was on my comment about the
Okay,
question.
let's do a sidebar here. We're not doing talking. Ladies and gentlemen, y'all may be seated. Thank you. Let's bring the witness back in. Come back up. You can have a seat, relax. Remember, you're still on the road. You can never keep talking loudly, too.
Okay.
Mr. Baez. Thank you. Mr. Ebrow, we left off with a confusing question. I want to ask it a little more clear if I can. Have you ever worked with Tyler Redmond?
Yes, I did.
Have you ever worked with Derek Dreyer?
Yes, I did.
Have you ever worked with Jacob Deemer?
Yes, I did.
Okay. In this time, you also mentioned that you, in this case with Miss Austin, that there were several nurses assisting you, correct?
Yes.
And you have fair to say you have a good working relationship with your team at the ICU?
Yes.
Would you classify that team as a family, a team, a romance, any one of those? Is that fair to you?
In the ICU, I mean, a lot of our patients are critical, so everybody tends to usually help each other. It's, you know, if you're not doing anything, you go help out, and that was just the culture in our ICU. We helped each other.
Would you describe the culture in the ICU as a positive one?
Yes.
Positive and that ultimately help the patients
Yes.
and improve their care?
Yes.
Did you ever see, well, I'll strike that. All right, let me get back to, remember when we were discussing Dr. Brady being in the, arriving at bedside? Do you recall that line of questioning?
Yes.
And then you said you couldn't recall whether he had seen the agonal breathing. Well, you did. You saw that she started to agonally breathe when he arrived. And then I asked you about the heartbeat. Do you recall that?
Yes.
If I showed you Dr. Brady's history and physical, might that refresh your recollection?
May I see this?
While she's doing that, I want to show you again States Exhibit 10E. Do you see that?
Yes.
And I believe you said the palliative extubation occurred at 23:30, right about that time?
Yes.
So at this time, during the extubation, Miss Austin was breathing at 16, that was her respiratory rate, 16 breaths per minute?
Yes.
And that is within the normal range of 12 to 18, correct?
Yes.
In addition to that, when she was extubated, her blood pressure was 64/12, was it not?
Yes.
That's about half the normal rate, correct?
Your
Yes.
Honor, object.
So
Permitted.
with her blood pressure, she was on a blood pressure medication that was helping keep that blood pressure up. So that was stopped, and that's why her blood pressure right there is the 64/12 at that moment.
And then the next thing that we see here is there's actually no reading at 23:45 of her blood pressure, correct?
Correct.
That's 15 minutes later. Her heart's not pumping enough to generate a blood pressure, correct?
Yes, at that point, the blood pressure was not reading.
But yet she's still breathing at 5 breaths per minute, correct?
Correct.
Or did you give it back to me?
I'm keeping it from
All
you.
right.
Can't have it back.
Thank you for it. Now, if I showed you Dr. Brady's notes, Might that help refresh your recollection as to whether he was able to determine a heartbeat?
Sure.
Your Honor, object to refreshing his recollection with another individual's notations.
He said it could possibly refresh his memory. I'll permit the showing.
Does that refresh your recollection?
Yes. So in that note, he talked about auscultating heart sounds, basically listening to heart sounds. When he came in the room, he did his own assessment, his stethoscope. He listened to the heart, but I don't know. He didn't tell me what his findings were, but that was just part of his assessment that he did.
Okay. So we have that, and then also, but we definitely know from State's Exhibit 10E that she had no blood pressure, but she was still breathing, correct?
Yes, at 23:45.
And her heart had stopped multiple times even before she got to the hospital, correct?
Correct.
And when your heart stops, you're basically dead, correct?
Essentially, I mean, she's still breathing. I mean, then, based off of the doctor's judgment at that point, then they would declare whether the patient is alive or not.
And she was being kept alive through the ventilator, which was later withdrawn, and her heart was the pacemaker was assisting her heart from beating as well, right?
Yes, and she was also on blood pressure medication.
And blood pressure medication is a vasopressor, correct?
Correct.
And those, once a vasopressor is turned off, it stops working fairly quickly, correct?
Object.
Sustained.
In your education and experience, are you aware that how fast a vasopressor stops working once you turn it off?
Object, Your Honor.
I'll permit that question.
So with the vasopressor, it's very. So I'm trying to put it in it's very kind of touch. So if your blood, so that's why we never let the vasopressor run out. So even if it runs out for
Object,
30
not
seconds.
responsive, Your Honor.
Okay, hold on. This is your experience, correct? Okay, you can finish your answer.
So with the vasopressor in the ICU every time, so even when there's about 20 mils left, you'd get a new one because you don't want to have even a moment of the patient not being on the vasopressor because their blood pressure drops very quickly usually.
And you have those things, and then even the pacemaker is helping her heart beat, correct?
Yes.
Object.
And
Well, I'll permit that.
when she was
But
extubated, you also took that pacemaker off, correct?
Yes.
So she didn't have the assistance of that pacemaker helping her heartbeat.
Yes.
I have no further questions. Thank you, Mr. Eaton.
Hold
Yes.
on.
Oh,
Yes.
actually,
One
sorry.
moment, Your Honor. We can converse. Thank you.
This one's not on me.
One moment, Your Honor. I apologize.
I gave all that to Jose.
Here?
No, keep going. The one you just showed had a sticker on it.
I know. I'm blinded by paperwork. There you go. Oh, no, that's not it.
No.
Mr. Eberl, I apologize, I thought I was done. The fentanyl was given at 23:23, correct?
Yes,
And that's showing you Joint Exhibit 10, page 106, and then back to State's Exhibit 10E. So at 23:23, after getting it administered, at 23:30, which is several minutes after, she's still breathing at a normal rate, correct?
yes, that's when she was extubated.
Okay. So she already had the fentanyl in her system at that time?
Yes.
All right, no further questions. Thank you.
Ms. Grubb?
Oh, wait, these are all Janet. Did you guys put them back in order? No.
No way.
No way.
Do you want this too? No?
That's yours. Anything with the white stickers, that's yours.
Okay.
Hi, Yusuf. I'm back for one question. So just to look back at the respiratory rate, 23, 22, or 23, 23 was the time of administration, correct?
Yes, that's correct.
Okay. And then we note that the declining respiratory rate down to death 30 minutes later, correct?
Yes,
That last notation indicates that she had passed at that point,
yes.
correct? And then how many times between administering the drug and her passing did you check?
Are you talking about the
On her
respiratory rate?
respiration, I'm sorry.
Are you talking about the respiratory rate?
Yeah.
So she's on a continuous monitor so that it tells me, as you can see also, the pulse oximeter also drops to 84%, right underneath it right there at 23:30. So that's after the ventilator's out. So that's like a continuous. It's like a monitor, yeah. So it tells me kind of like in real time what's going on.
And what direction is this all heading?
I mean, as soon as the tube was, as soon as she was extubated, her pulse ox drops, her heart, her respiratory rate drops, and that was because the ventilator, there's usually a set amount that's on there.
Okay, thank you.
Okay, you may, that it? You were walking the other way, I couldn't hear what you said.
Oh, I'm sorry, Your Honor, nothing further.
Okay,
Thank
you
for
may step
coming.
down, sir. Thank you very much. Call your next witness.
Your Honor, the state calls Lisa Hayes to the stand.
You solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God. Okay, you gotta have your stuff there. Go ahead and get yourself comfortable in the chair. Okay. Now you got that mic there in front of you. I need you to state your name and spell your name for us.
Lisa Hayes,
Lisahays.
Okay. You got a little more volume for me?
I'm sorry?
Can you give me a little bit more volume?
Oh, yes, I'm sorry. Is that better?
State your name again and spell it, please.
Lisa Hayes, Lisahays.
Ladies and gentlemen, of the jury, are you able to hear? Okay. Mr. Zion.
Good morning, ma'am. How are you today?
Good, I guess.
All right. We're here to talk about your brother, Ryan. Was he your older brother or your younger brother?
He was my baby brother.
All right. Where did you and your baby brother grow up?
We grew up in Grove City.
Where did he go to high school?
He went to Grove City High School, and then he also went to Mullersport High School.
Okay. Remember what year he graduated or what year it would have been?
I don't think he did graduate. I think he got a GED.
All right. My question is, how old was your brother when he passed, if you know?
39.
All right. After high school, did your brother have some problems with the law and with drugs?
Yes, he did.
All right. Were you part of that? Scene that he was into with the drugs and the problems?
No, I was not.
Was there a time when you two were apart because of those things and not close because of his drug use and his problems he was having?
Yes.
At some point, did you two reconnect?
Yes, we did.
All right. When did you two reconnect?
About 2 months before all this happened.
All right. Well, do you remember the date specifically that your brother passed?
It was April 3rd, April 4th, I do believe, because it was like right around midnight is about the time that he passed away.
Okay. Of what year?
2017, I do believe.
All right. So it would have been maybe in February that you would have reconnected, February, March, sometime of that?
Somewhere around that time, yes.
All right. Where was your brother living at that time when you reconnected?
He was staying, when we reconnected, he was staying with his brother, Donnie. And then when we reconnected, he started staying with me.
All right. And why was he staying with you? Were you trying to...
His job, his job was literally right down the street from my house.
All right. So it was convenient for him?
Mm-hmm.
All right. Taking you to a few days before he died, did you and your brother go out anywhere in the evening?
Yes, we did. We had went to a little bar right down the street, right around the corner from my house.
What did you and your brother do that night?
We had a couple of drinks together.
All right. Did you and your brother drink too much, get drunk?
No, we just had a couple of drinks, and then we had went home.
What time do you think you had gone home after having a few drinks at the bar?
I would say probably around 7, 8, I would imagine, somewhere around there.
All right. Besides the alcohol, did you see your brother use any other type of drugs that evening?
No, I did not.
Were you aware of, at that time, whether your brother was actively using any type of other illicit drugs?
Yes, I do believe so.
What drugs do you think he was using at that time?
I have no idea.
All right. You ever part of that scene with him at all?
No.
All right. So you got home around 7. What's the next thing you remember happening? You guys, what do you do?
We come into the house, and I have an office in my living room, and I was sitting at my desktop playing my game, and my brother was watching TV and talking on his phone, messing with his phone, and then he had decided that he wanted to take a bath. So he,
All right, I'm just going to ask, a bath versus a shower, why?
because in my house, we don't have a shower, all we have is a bathtub.
Okay, so he's going to take a bath. What time is this, you think?
I'm horrible with time. I'm going to say probably about 9:30. It's probably like maybe a half an hour to an hour after we had gotten home.
All right, so these are your best memory, you're estimating?
Mm-hmm.
Okay. So what's the next thing you remember happening?
I remember sitting at my desk playing my game, and then it seemed like the water had just been running and running and running. And I was like, it just seemed odd to me that the water had been running for so long.
You mean the bath water?
Yeah, the bath water.
Uh-huh.
And I went into my room, and I knocked on the bathroom door, and I said his name, and he didn't respond to me, and the bathroom door was locked. Well, in my other bedroom, you're also able to get into the bathroom that way too, and that door was unlocked, and I went into the bathroom, and my brother was slumped down in the bathtub.
and I smacked him in his face, I hollered his name, and he didn't respond to me. So that's when I proceeded to call 911.
Okay. Now, was the tub overflowing, or was it just running and going into that?
No, it was just, no, it hadn't started to overflow or anything.
All right. When you say your brother was slumped down in the water, was he underneath the water, or was he?
No, no, he was not underneath the water. His head was up here, and the water was probably, down here.
All right,
He
so
was
for
like
the
leaning
record, you're
against-
indicating 5-6 inches below his head?
Yeah.
Okay. You slap him on the face, you don't get any response. What happened next?
I hollered his name. I splashed some water up in his face. He still did not come to, so then I called 911.
What happened next?
The paramedics showed up, and then I'm not for sure, I want to say the paramedics showed up first, and then the police arrived. The paramedics took my brother out of the bathtub into the spare bedroom, and that's when I left the room. I just couldn't handle watching what they were doing to him, so I went out of the room, and there were police officers in my living room.
What happened next?
Then they took me outside and put me in the back of a paddy wagon.
What happened next?
I was left in a paddy wagon. I'm not for sure what happened inside the house or whatever. All I know is that the next thing I know, the squad was taken off and my brother was in the back of it.
What happened next?
Then they finally released me from the paddy wagon, let me go inside my house. I had called my friend. She came and picked me up, and we went straight to the hospital.
What hospital had they taken your brother to?
Mount Carmel West.
All right. What happened when you got there?
We got there, I remember he was in ICU, and if my memory serves me correctly, we had to wait in the waiting room for a little while. And then, I can't say 100% sure enough I seen him that night, because it was my baby brother. I was torn apart. I'm not really sure what happened after that.
All right. Did you spend the night at the hospital, or did you come back the next day?
No, I came back home. I literally lived 5 minutes from the hospital. So I went back home, and I was right back up there the next day.
Do you remember what date this was specifically that your brother went into the hospital?
It had to be around April 1st, somewhere around that time.
Okay. You come back the next day, you said?
Yes.
What happened? What did you do when you came back the next day?
The next day, they had him in a room in the ICU unit, and I was able to go in, and I was able to visit him.
All right. Describe what you see when you go in to visit your brother. Looking back in your mind, you're walking into the room. What does he look like? What's going on?
They had the bed sitting up, and he was like kind of sitting up in the bed, but he was completely comatose. I mean, it was like he was asleep. I mean, he didn't move, he didn't speak, nothing. It was like he was just laying there.
Did he have a tube down his throat?
I can't remember.
All right. Were you able to talk to your brother?
I was able to talk to him, but he no response back from him whatsoever.
All right. Did your brother appear to be in any distress, or did he appear to be in any pain?
No, like I said, he never moved the whole time. Anytime I was ever up to visit him in the hospital, he appeared to never move. He was always in the same position. I mean, nothing. There was no response, nothing from him whatsoever.
Okay. Do you remember having a conversation with a doctor about turning off life support and letting your brother go?
Yes, because that was our major concern, is that we did not want to leave him on any kind of machines at the time. We definitely wanted to proceed with taking him off the machines.
Do you remember having a conversation about organ donation?
Yes.
Tell us about what you remember from your memory about what that conversation was about.
If memory serves me correctly, my brother on his ID, he did have organ donation on his ID. And so they took us to a room and they started discussing with us about organ donation. I think the first conversation that we had about it, they had to, I want to say they had to run some tests or check some things out. And then we went back into the room again and they proceeded to tell us that they didn't think that it was really viable at the time because the amount of time that he had spent in my bathtub, being non-responsive.
You mean viable for organ donation?
Yeah,
Okay.
yes,
Did your brother have any children?
yes.
And how many children did he have?
He has one living child and his other son had been murdered.
Okay. His living son, was he local?
No, his living son was in North Carolina.
All right. Was his living son an adult?
Yes,
All right. Was he notified to your knowledge?
yes, he was.
All right. And was he on his way up to see his dad?
Yes, he was.
All right. So when you found out that doing organ donation wasn't viable, did you then proceed to authorize the life support to be taken off, or was there some delay?
Well, his son got up there very late, and his son was just completely devastated. It took his son about an hour or so for everything to sink in, us talking to him, and him, realizing the situation. And after that, I say about an hour and a half, he also came to the conclusion that it was time to take him off the machines.
All right. So you got time to spend with him before taking him off the machines, and his son got some time.
Correct.
All right. Did there seem to be anything emergent or like really urgent about doing this right now?
No, that was the thing that the nurses, the doctors, everybody kept saying that we had to wait for his son to get there to make the final decision.
All right. So this was a planned thing in your mind?
Correct.
Okay. Did they talk to you at all about the necessity or the need to give your brother any type of pain medication or anxiety medicine when they would take the life support off?
I don't remember. I was so torn up about the whole situation that I remember talking to the doctors, but I don't remember what we talked about.
Okay. So did you observe anything that would indicate to you that your brother, even at this point of his hospitalization, that he needed pain medication or something to calm him down?
No, not at all, because like I said, the whole time that I was there, he was non-responsive. He didn't respond to anything. There was no movement, no twitching, nothing. It was just like he just laid there.
Okay. So were you in the room, or were other family members in the room when they pulled the tube out?
I was in the room, his son was in the room, and his brother was in the room. Those are the only other people I remember, but like I said, I don't remember a lot.
So you were there when they pulled the tube out?
Yes, I did. Yes, I was. All
right. When they pulled the tube out of him and the life support was turned off, what happened next?
They left after they took him off the machines, everything. The doctors and the nurses left the room. They gave us a couple of minutes alone with my brother, and that's all I can really remember after that. I just remember saying my goodbyes to him, and that's all I can really remember.
After life support had been withdrawn from your brother and you're saying your goodbyes, at any point during that time frame, was your brother showing any signs of pain or anxiety or a need to get more medicine to help relieve those things?
No.
What's the next thing you remember?
I just remember leaving the hospital. There's like a complete blank, from the time that I said goodbye, and that was it. That I just remember leaving the hospital after that.
All right. At some point afterwards, years later, do you remember getting a call from the hospital regarding the death of your brother?
Yeah, I remember getting a couple of phone calls from the hospital, but I was still so, I couldn't even imagine why they was calling me.
All right.
So I just ignored them.
Okay. At some point, did you talk to the police? Do you remember the police coming out and talking to you?
Yes, at the time I was working really late at night, and I had missed a phone call, and it was a voicemail, and it was from the homicide department about my brother.
All right. And did you
And-
talk, go ahead.
I called them back, and they said that they would want detectives to come out and speak with me, and they was out the next day.
And did you speak with them?
Yes, I did.
And to your knowledge, was there ever any civil litigation, meaning suing somebody for money over this?
Yes,
All right. And is that matter now resolved?
yes.
Thank you. I have no further questions. Ms. Menashe may have some for you. Thank you.
Cross.
Good morning.
Good morning.
Diane Menashe on behalf of Dr. William Husel. Let's go back in time. So I want to make sure that we have a very clear timeline here. On 4/2 of 2017, you dialed 911, correct?
Correct.
Because your brother was passed out in the tub and was non-responsive,
Correct.
completely non-responsive.
Correct.
In fact, isn't it true that you've said a number of times that when you found your brother, you used the word dead?
Yeah, that's how he appeared to me, I thought that he was dead.
And the tub was full of water, correct?
The tub, it was partly full. It was partly full.
There was water in the tub.
Yeah, there was still water in the tub.
And was he clothed?
No, he was in the tub. Why would he have
was
clothes
naked
on?
in the tub.
Yeah, he was inside the tub.
And then after you calling 911 on 4/2 of 2017, the police and EMS arrived, correct?
Correct.
And then as a result of that call, the police searched the house, did they not?
Yes, they did.
And you're aware that they found some paraphernalia or drug material in or around the area where Ryan was found?
Correct.
And then that same, within minutes, he's taken by the squad to Mount Carmel West.
Correct.
At some point after that, you and your friend drive to the hospital together.
Correct.
You're not sure if you stayed that night or not, but you do have a recollection that you saw Ryan during the day on April 3rd of 2017.
Correct.
And before we talk about the events of the 3rd and the 4th, I want to go back to the timeline. You received a phone call, or calls were made to you from Mount Carmel in early 2019.
I'm not for sure. I'm not for sure when, I just know that I received a couple of phone calls, and like I said, I was still not over my brother, so I don't know when they called.
And your brother passed on 4/4, technically, of 2017.
Technically, yeah. Like I said, it was around midnight when everything happened.
And then next on our timeline is your interview with Columbus Police Department. Do you remember being interviewed by Columbus Police Department?
Yes, I do.
And which detectives were there with you? Do you remember?
I don't remember names.
Does it look familiar that the man in the back was there?
Yes.
Okay.
Yes.
And so Mr. Detective Croom was there, and the date of that interview was February 20th of 2019.
That sounds about right.
And fair to say that was the first time that you were really asked in detail about the days that your brother spent at Mount Carmel West.
Pretty much, yes.
I assume, Ms. Hayes, that during that Columbus Police Department interview, you did your absolute best to tell the truth.
Yes, I did.
And whether you were under oath or not, you you took the time and attention to answer the detective's questions, right?
Correct.
Because I want to go back to something that you just said on direct versus what you told the detective.
Okay.
Because you told the detective, did you not, that actually when your brother was extubated, you couldn't be in the room because you did that with your mother, and it was one of the most horrifying experiences.
I do not remember that. I don't remember that at all.
If I showed you a certified transcript of your interview, might it...
Oh, no, I believe what you're saying. You don't have to show me anything. I believe what you're saying. No, because I was in the room. I was in the room because I was there with my nephew at the time.
So, and so would it refresh your recollection as to what you told the police in the year of 2019 if I showed you a transcript?
Possibly.
Okay. May I approach?
You may.
Thank you. If I may, sorry.
Oh, that's why I'm sorry.
Sure, I've highlighted that portion.
Okay.
No need to read out loud, just use that.
I don't, like I said, I remember the police being there, but I don't remember much of the conversation. I don't remember much of any of this. It's been one horrifying experience. I don't remember much of any of it.
Okay. And so, and I ask this because, as you can imagine, on behalf of Dr. Husel, I have to ask this.
No, I understand.
Yeah. When you say you just don't remember any of it because it was so traumatic, right? But you testified to things here today. It is March of 2022. Would you agree with me?
Mm-hmm.
5 years almost since the passing of your brother. And just as a human, you would agree with me that your memory isn't getting better with time.
Correct.
And so that's why it's so important about what I'm asking you as to what you told the detectives in 2019.
Okay.
Let me ask you
Counsel,
this.
please.
Let me ask you this question. Did you, for purposes of context, have a horrifying experience seeing your mother extubated?
Objection.
Yes.
You did.
I'll permit it.
You did have a horrifying experience seeing your mother extubated. And
Well, actually, not the part of her being excavated. It was the after. I went in and seen her after was the horrifying experience.
you saw her suffering while she was
No,
there.
it was, she had already passed away, and she was laying in her bed. She had multiple sclerosis, so she was very crippled up. And when I went back in the room and seen her, her mouth was wide open. It was just horrible seeing her after she had been excavated.
And so looking back, does it make sense that, in your own opinion, that you wouldn't want to have another experience like that?
Correct. And that's the reason why never mind, go ahead.
Well, and I just want to make sure, because you were asked questions about whether or not Ryan had pain, in your opinion, after he was extubated. And of course, if you weren't in the room, you wouldn't be able to know if Ryan had pain.
Correct.
And of course, none of us really know, would you agree with me, whether Ryan suffered any pain or not, because we weren't Ryan.
Correct.
So then, I want to go back through some of the other things that you talked about. When you found him in the bathtub, you thought he was dead. You mentioned that he had discharge. What did you mean by the word discharge?
There was a discharge around his genitalia.
And based on, at the time, you hearing the water running, fair to say that your estimate as in terms of how long he had been there was probably 10 or 15 minutes?
Pretty much.
When you were talking on direct about knocking on the door to get in, you had to go around to a different bedroom, did you not? Because he had locked the door.
Yeah, correct.
And at the time, certainly you knew that Ryan was known to abuse illegal drugs.
Correct.
And then when you continued to get to the hospital, you thought, did you not, as you told detectives, that Ryan remained dead?
Yeah, I thought that I was going to get to the hospital and they'd go tell me that he passed away.
And that's what I was going to ask you. When you're driving there with your friend, isn't it true that your thought going to the hospital is you would get there and they would tell you that Ryan had been determined to be dead?
Correct.
But they tried to save him.
Yes.
You were asked questions about conversations that you had with doctors. You were visiting your brother during the day shift, did you not?
Correct.
You don't remember any of the names of the doctors that you spoke to during the day shift?
I'm horrible with names. I do not remember any names.
And your time in the ICU there with your brother also involved the night shift?
Correct.
And at no point in time, either in 2019 or today, do you remember the names of doctors that you spoke with?
No, I do not.
And I'm sure if you remembered the name of the doctor you provided.
Correct. Yeah, like I said before, I'm horrible with names. I call everybody baby and honey, so I don't have to remember names.
And in fact, with respect to names, do you remember telling the detectives there was so many doctors?
There were so many doctors and nurses coming in and out of the room that it was just, I mean, it was hard. And like I said, I was completely, this was my baby brother. I never in a million years thought I would be in this position with my baby brother. So I was out of it.
Sure. And in addition, I presume, to the trauma of being at the hospital, fair to say you also had some trauma from finding.
Correct.
Then you're at the hospital and there's so many doctors and nurses. There was also a chaplain assigned to you and your family, was there not?
Correct.
Do you remember the name of the chaplain?
No, I do not.
There was one with you.
I don't remember. I remember that my uncle had brought his minister up, and that's the only chaplain or minister that I remember being around.
You remember saying that actually they were telling the Columbus Police Department in 2019 that there was a chaplain there, but some of the things the chaplain was telling you about being saved, you actually disagreed with.
Correct, yes. That was the chaplain I was just talking about, was the one with my uncle. He came into the room talking about how he had been in the same position and he came back to life and all this. And it just really bothered me because I just knew that there was no coming back. I mean, the whole time my brother had been in the hospital, he never moved, he never talked, he never did anything. I mean, it really upset me, so I left the room.
And which explains why, does it not, that you told the detectives your brother was he was gone at that time?
That was my perception of it all. I thought he was gone. I mean, when you see somebody not responding, not moving, I mean, it's like he was just a statue. I mean, he never moved, nothing.
And so during the family starts talking about, with the day shift doctors, end of life, correct? Whether or not the family wished to continue having Ryan on the ventilator. You remember those conversations?
Vaguely.
And you vaguely remember, as you testified to, there was conversations about organ donation.
Correct.
Multiple conversations, won't ask you specific, but multiple conversations, fair to say, about whether or not his organs could be harvested to save another person.
Correct.
And lots of time and some testing was done to see if from Ryan's passing something good could come of it.
Correct.
And it turned out that actually, given the state of his being, that his organs could be harvested and saved.
Correct. As far as I know, correct.
And so once that, and again, going back in time, once that knowledge came to the family, then I want to go back to what you said on your rec, that isn't it true, family was adamant that having Ryan on a ventilator was not what his wishes were.
Correct.
But had taken the day on the 3rd to really explore the organ issue.
Yes, correct, because like I was saying, I do believe that he was an organ donor. So and if I'm not mistaken, I do believe it was his wishes, if he could harvest his organs, that is what he would want it.
And no doubt that you wanted to make sure that Ryan's wishes were always followed, especially
Correct.
when he's ended life. And so Ryan didn't want to be on the ventilator, and you knew that as his sister.
Mm-hmm.
There was a decision made at that time that that his son had to be called before anything could be done in terms of an extubation.
Correct.
Correct. And his son lived in North Carolina at the time.
Correct.
Fair to say they had not a great relationship.
No, they had no relationship whatsoever.
Even so, son got the call, drove the 6 or 7 hours to the hospital.
Correct.
When he got there, and again, he being the son, talked to the family about where the family stood with respect to the extubation, correct?
Correct.
Everybody got together and talked about what's happened to Ryan, right? Where Ryan is now, and what would Ryan want most. Is that fair to say?
Correct.
And at that point in time, after the family had the opportunity to meet and talk, the decision was made by those that had the power to make it, that Ryan should be extubated. Is that right?
Correct.
The prosecutor asked you about if this was emergent or rushed. Fair to say that April 3rd was spent taking time and attention to making the right decision for that.
No, the time was taken because the hospital told us that we had to wait for his son to be there for it to happen. The final decision was left up to his son, that me and his brother did not have the right to make that final decision, that his son had to make the final decision.
Because fair to say that if it had been your decision, you actually would have made it earlier in the day on the 3rd.
Correct. Yeah, oh yes.
You wouldn't have waited into the night shift of the ICU, right?
Correct, yes.
It was that you were told by the hospital, the doctors and staff, well, we have to wait.
Mm-hmm.
And it was only because you waited that the extubation was done at night. Is
Correct.
that correct?
Yes.
One moment. One moment, Your Honor. After you met with Columbus Police Department in February of 2019, did you ever have another interview with them?
No.
This is the only interview.
Yes.
Have you ever been shown any pictures of doctors that you might have had conversations with when you
No.
were at the ICU that night?
No.
Is it true that you just don't remember?
I just don't remember.
And you were honest about that during your 2019 interview?
Correct. I have no, I mean, vague, recollections, but that's about it.
And with respect to your brother's actual cause of death, did you ever see a death certificate?
No, I did not. His son had gotten all that.
It had gotten his death certificate because he was the next of kin.
Correct.
And there's certainly no doubt that when the son arrived, despite their non-existent relationship, that he came to a place where he agreed that
Correct.
extubation was the appropriate decision to make.
Correct.
And then after the decision was made by the person that could make it, which was the son, Brian was palliatively extubated and then passed. Is that correct?
Correct.
further, thank you.
Redirect?
Waited till the nighttime shift to do the palliative extubation. I'd like to talk to you about that. It was agreed by the family members that were there, you testified to. Let's get this done during the daytime, right?
Correct.
Is it your memory that that's what the doctors were telling you too during the daytime?
As far as I remember, yes.
So but for having to wait for the sun to get up from North Carolina, this would have been done during the daytime.
Correct.
And he's not moving at all?
Not at all.
He's just there taking up a bed in the ICU?
Correct.
Objection, Your Honor.
To the characterization, I'll sustain and rephrase.
Is he just lying there in the ICU?
Yes, he is.
The decision has been made that he needs to be that everyone wants him palliative extubated?
Correct.
Weren't able to get it done during the day?
Correct.
Had to wait for the sun?
Objection, Your Honor, asked and answered at this point.
I'll permit it here, but let's move on. It has been brought up.
Did it suddenly become urgent or an emergency once the sun got there?
No, not to my recollection. No, not real. I mean, we was given time. I mean, we was all in the room. There was a lot of crying. There was a lot of talking. You know, it was a very emotional time. So,
And did you see your brother at all suffer as far as pain or anxiety in
no,
any
like I
way?
said, there was no emotion. There was
Objection, Your Honor, yes
nothing,
and answered.
nothing from my brother at all.
This is redirect, Your Honor.
It's redirect. I understand. I'll permit the question.
No, there was no response from Ryan at all during the whole time he was in the ICU unit.
And even after they took out the tube, did you see anything?
Not that I can remember, no. I mean, maybe his body lifted up, you know, from where they just took the tube out. I think that always happens, but that was about it.
All right, but after, like 23 minutes later, was there something?
Objection, Your Honor.
It's leading. Go ahead. Let's reach where
Just
asked.
referring to the time frame, not when they took the tube out,
No.
but 23 minutes later, did you see anything in your mind that indicated that he needed, say, 1,000 micrograms more of fentanyl?
No,
Or 10
Objection,
milligrams
Your
of
Honor.
hydromorphine?
Okay.
No.
There's an objection. It's overruled at this time. You're starting another question. What is it?
Or 10 milligrams of hydromorphine?
no,
Okay.
Or,
I assume the objection for the record?
Of course, yes.
Okay. Overruled.
or 6 more milligrams of bedazzling?
no.
Thank you. I don't know.
I'd like to redirect on those recross on those last two questions.
I believe it was
Wow.
outside the scope, Your Honor.
We're going to have to go talk on the side here for a second, ladies and gentlemen. Ms. Menashe?
Take care.
Sorry.
Just two questions. You don't have any medical training, experience, or expertise, correct?
Correct.
If, when the decision was made, palliatively extubate, if the doctor had said to the family, is it okay to give enough medication so that Ryan doesn't suffer pain when dying? You would have said yes, would you not?
Correct.
Nothing further.
Okay. You may step down, ma'am. Thank you. It's getting close to the top of the hour. Why don't we go to lunch now? We'll come back at 1 o'clock and continue on. Fair enough? Unless you're dying to get a witness on in 15 minutes.
I'm not dying to do that, Judge.
Okay. Ladies and gentlemen, have a wonderful lunch. We'll get started at 1 o'clock. Madam Bailiff.
All right.
You're all done. Thank you. Oh, Judge, our next witness is at 1:15 on Zoom.
Well, it's 1:15, guys, so that's when the Zoom conference is. So you got an hour and a half. Enjoy. And remember the admonition.
Who's at 1:15?
Okay. You ready, Sam? Yes. Mrs. Zion, anything for the record?
Nothing to state, Your Honor.
Ms. Menashe?